Hi, I'm Dr. Lonny Green at Rêvée Aesthetics. You can find me on Insta at Ninja Injector. And thanks for taking the time to watch this. I'm here with KP, my medical assistant, and I wanted to talk to you a little bit about how I view a face in terms of assessment for fillers and how I do fillers in my philosophy. I am going to say right at the outset, I'm not saying my way is the right way. My way is just the way I find I get the best results in my hands. Big points are, when I assess a face, I look at the top third, middle third, bottom third, and I look at lips and jawline separately. The other thing I do is I don't do fillers by syringe. I know that most injectors do, and in my hands it's a little constraining. That approach to me is more like going to a painter and saying, I want you to paint me a beautiful picture, and then giving the painter the color red, because they might paint you a cherry or a tomato, but you're kind of tying their hands. So when I assess you for filler, I'm going to look at each zone, and I'm pretty good at assessing how much filler I would need, and then I just base the pricing on what I think I would need to do that area. And I think that in my hands it gives me the ability to use any filler I want in any combination I want, and it's more freeing for me. The other thing I do is within each zone, the top third, middle third, bottom third, lips and jawline, I do the area together, which means that, let's say in the middle third of the face, people may get a little emptiness in their cheek or a little hollowness near their eye, and I don't just fill that hollowness in one area. I do the entire zone together, because in my hands I get the most natural approach. Again, it's different than some people, but I believe that lets me use what I want to do and make this area flow. I'm not suggesting one has to do the entire face, not at all. That's a fun thing for me to do, but there's a different time and budget for everyone. But if you, for instance, if KP said, I really hate this little tiny fold here, and I want to fix that, I would say, look, I want to make that whole area flow together. She's not a great example because she's gorgeous and has no volume deficits whatsoever, but I think you get the idea. So I appreciate your time listening to this, and encourage you to look at my work if you're interested, because I think it's really important that you find an injector whose style matches your vibe, because we want everyone at Rêvée to wake up more confident in their own skin. That is our just cause, and we will continue to do that. Thanks for joining us.